welcome from the PIIC Center, Infectious Disease Specialist, Dr. Donna O'Neill.
Good morning.
Happy Easter.
Thank you.
Happy Easter.
They never know what I'm going to talk about. So they said, what are we going to talk about? And I said, you'll see.
I did. I said, what are we going to talk about? I have some...
Guess what month it is?
It is April.
Okay, but you know how they come up with certain
Infectious
days?
Disease Month?
Close. What's infectious disease?
Sepsis.
No. But you're close. It starts with an S.
Shingles.
No.
Scurvy?
I said it's going to make your dad all embarrassed.
STDs.
Yes.
Oh.
Although it's been changed to I.
STI.
STI.
Yeah.
Okay.
And I think next week is the week, but it's the whole month to bring awareness to it. And there's two things I want to bring up. So the first one we missed in January talking about it. In the United States, we had a really scary 2 cases in Massachusetts of a really resistant gonorrhea. And this is an infection that every drug we give it gets resistant to. So starting back with sulfa, penicillin, tetracycline, azithromycin, the cephalosporins, and now we have one drug left to use. And what we've done with this drug is it keeps getting harder to treat and we keep increasing the dose. So, I mean, we're focused on too many other things, and this is really important. And our rates have really gone up. So all the rates have gone up of all the STDs. I mean, it's really sad. For example, congenital syphilis. This is where the mom hasn't had typically prenatal care and hasn't been tested. Totally preventable, totally treatable. Mm-hmm. But in Michigan, we had 42 cases last year, or pardon me, of 21. And one of those, unfortunately, was from Jackson. It can really profoundly affect, the newborns.
Mm-hmm. What is gonorrhea? I mean,
So that's what they used to call the clap.
Okay. That's
Do you know why they called it the clap?
No, I didn't. But I can tell you, it's, this is bringing back like playground memories for the, the boys used to say, hey, you've got this stuff, right?
I don't know.
That's what we used to say on the playground.
So I think the word comes from a French word meaning brothel, but I think in the old days, how they treated it was they put a heavy object on the man's penis to try to get rid of the infection.
Oh my God. And we do not have any visual aids for that. Interesting.
So it's a bacteria. It's transmitted sexually. You can get it in the throat. Obviously, you can get it with discharge in the morning, burning when you pass your urine, itchiness in the backside.
There's some people watching probably thinking, uh-oh.
Well, this was Dr. Kack's idea to talk about this today. It's all his fault.
No, I think it's a great idea to talk about it.
But half of the cases have no symptoms, and that's how it's getting transmitted. And of course, they're blaming COVID for everything, and that's why they say our cases have increased, because we were not testing, everything was closed down, so there were a lot of cases that went undetected and not treated.
So do people are there like home remedies that people are trying, and then when they show up at the doctor, it's too late?
Maybe they use smelling salts. I don't know.
How does someone know, right? Like you said, some people don't have symptoms, and what do you do? So
if you're in a risk group, family doctors are supposed to screen people. The health department does a lot of contact tracing. Pregnant women get tested. Mm-hmm. So it's one of the things we talked about at our meeting that I went to in February about this scary case.
So people are coming into your office with these STIs?
Well, actually, we usually don't see them, but last year we saw a lot of sexually transmitted infections, especially syphilis. Are some,
I'm sure there are some people are in a higher risk category for these infections. Mm-hmm. Yes.
It's all about your behavior. We heard about monkeypox last year.
Yes.
I mean, this one has been around even, I think 2000 BC. So it's a very ancient disease. And it's very adaptable. And oftentimes it's associated with other STIs. The number one STI is chlamydia. This one's number 2. So.
I learned one thing. I didn't know you could say the clap on TV until Dr. Donna said it.
And so did you.
Yeah, well, I wanted to. No, I did say it.
For those of you enjoying your Fruity Pebbles this morning, we apologize for the the nature of today's
And again,
conversation.
the topic was selected for me by my partners. This is
You got to
not-
have uncomfortable conversations once
Well,
in a
you have to
while.
talk about it so
That's
people
what-
know. You
People
know.
they're probably afraid,
People are afraid.
to come in and talk to their doctor about it. They're embarrassed.
So, is it common that when a lot of people contract these diseases, they are embarrassed and hide, or are
I
they
think they
trying
get
to treat
so, I mean, when they get symptoms, they're so uncomfortable,
Right.
and oftentimes they're going to urgent care or the emergency room. And typically when they, show up, they get treated for everything because it's kind of like your spaghetti and meatballs. These diseases hang out together.
Is there any preventive medications that, or
You wouldn't do preventive medications, but obviously wearing condoms helps, wearing them properly.
preventative behavior?
Behavior modification.
and is it men or women more likely to?
So men, and because men who have sex with men, their rates are really high. And it's another area where it's disproportionate. So in Michigan, 14% of the population is black, and with STIs, they bear a high burden, about 54%. So something else we talked about our infectious disease meeting, we have to start talking about it. I mean, COVID showed a lot of things, and that was one of them, our racial disparities of diseases.
What are some things young people should be aware of, obviously, other than the precautions?
To get tested.
Yeah.
To get tested.
Now, if you let it go, could it be fatal, any of these?
Rarely. Sometimes it can get out in the bloodstream, and it can affect the joints. If it goes undetected, unfortunately, women can get infertile because of it. They can get pelvic inflammatory disease. Rarely, it can go away by itself, I've read, but it typically needs to be treated.
And then they're apparently highly transmissible. Is one more so than the others?
I won't want any of them. I guess,
Can you
I mean,
get any-
the congenital syphilis obviously is one that bothers us. Because again, it shows it's a failure of our systems, when one of those cases happens. So lack of prenatal care. I mean, mothers are supposed to get tested in the first and third trimester, and there's treatment for it.
This isn't something we could catch at the grocery store walking by someone.
No,
right? Yeah.
intimate contact.
No, but I will still wipe down the handle at the supermarket with shopping carts.
So
Yeah.
another sexually
Yes.
transmitted disease that's probably a little bit more applicable universally is the CDC came out a couple weeks ago that they want everybody, almost everybody under the age of 60 to be tested at least once in their lifetime for hepatitis B. And over the age of 60 if you have any risk factors. And especially if you have any underlying liver disease, such as fatty liver, which unfortunately is very common. So that's a little bit more applicable. This is a disease that, is in our childhood immunizations, because if an infant gets it, unfortunately, 8 out of 9 of them end up with chronic hepatitis B. And because they're getting it at such a young age, oftentimes they can go on to cirrhosis, liver failure, and even liver cancer. So that's a little bit more universal for everybody.
Last week when I was with my sisters, I don't know if you heard this, but I found out, I never knew this, my dad had tuberculosis when he was a kid, and it was in a sanitarium for a while.
Interesting.
Yeah, never knew that.
Yeah, I found out a lot last weekend.
Yeah,
You like stamps, Dr. Donna? Are you into stamps?
Long
I've got a lot of stamps.
long time ago I was.
Yeah.
Yeah. I was-
stamps and coins.
Stamps and coins. Yep.
That was your inheritance, the stamps
Well,
and the
we're,
coins?
it's all of our, my dad, me, my brother, and my uncles and cousins, but we're just looking through them. We're just looking through the stamps.
They may be worth something.
Yeah, you never know.
Yeah.
Yeah, you never know.
Well, of course, Sunday is Easter, and Andy gave up candy for Lent. Did you?
Are you comfortable telling us if you gave
Oh,
something?
I did an assortment of things. I tried more globally carbohydrates.
Oh.
Yeah. So my husband had to learn a whole new way of cooking.
Interesting. Wow.
So until he met me, he didn't know what a salad was.
Well, that's hard because I know he's good at cooking pasta. Okay.
So now when we have pasta, I get these zucchini shreds. It tastes good.
Yeah.
Yeah. So I did an assortment of things, but that's what I tried to do.
Ted might have driven through the fast food on the way home one of those
I'm sure
days.
he did. And ice cream. Now that the ice cream places are open.
Yeah.
The pre-dinner.
Pre-dinner. Yeah. Yeah. Throw the wrapper in the back seat of the car.
So you're on the road for Easter weekend.
Yes, going up to Canada.
Awesome.
And that was another thing with COVID. You really weren't able to see several, including your mom, several of your family members.
Yeah, you think of the first Easter, right? That was the first major holiday we all went
My
through in the
mom
pandemic.
loves Easter, so I'm really looking forward to going up to Canada.
Yeah, it's hard to, I can't, believe nobody could go to church on Easter. Nobody.
Right.
That first year of COVID.
Yeah. Yeah. It
It's
was,
amazing.
yeah, no one did anything.
Well, we wish you safe travels and
Thank
happy
you.
Easter.
You too.
Happy Easter.
Thank you.
From the PIIC Center, Infectious Disease Specialist, Dr. Donna O'Neill. We're going to continue talking about health. We've got some folks in from the Center for Family Health.